Hello once again. I am Quentin Lucas, the mayor of Kansas City, Missouri. Thank you for joining us today. We have a little more information to talk to you about in our ongoing battle with COVID-19, and we have some unfortunate news to share. I'll start and then take questions. I'll be followed by our Director of Public Health, Dr. Rex Archer, who will have more information. We can say today that we have an outbreak at a facility in Kansas City North. The McCrite facility in our Northland has at this point 7 residents at a continuum of care facility, so assisted living, senior living, alternative living opportunities there. And so there are 7 residents that have tested positive for COVID-19. There are 4 staff members that have tested positive. A number of them have represented asymptomatic carriers, which is one of the reasons that we see things like wearing masks. It's one of the reasons that we have spent a lot of time in Kansas City talking about contact tracing. At this point, our Department of Public Health has been at the facility, I believe, all day. We'll probably be there even more to make sure that we're testing more. There are 80 residents at the facility, 80, and so we do not have full results back. We cannot say how far the outbreak has gone yet. We certainly, because we haven't been able to conduct tracing, we're not able to say how far in the community it has been either. I will note that we have previously had COVID-19 infections at senior care facilities, but this one is different because of the volume of persons that we have that have come down with it. We have been, up to this point, fairly fortunate in Kansas City by not having, in Kansas City, Missouri, not having facilities that have had greater numbers. It seems as if this situation will be somewhat different for us. And so the steps that we're going to be taking include some of the following. I know Dr. Archer and his staff have been working nonstop to make sure that we have testing very quickly. Indeed, this week, Dr. Archer and his staff here at the Kansas City Health Department have been testing a number of folks who work at the Triumph Foods facility in St. Joseph, Missouri, many of whom live in Kansas City. We have in excess of 100 persons who work at that facility. Thus far, we have tested a number of folks. We have more results to come back there. And so we do have some concerns that there might be another outbreak that is growing both from employees from that facility in St. Joseph and people who live in Kansas City and have been around our community. And then we add this to our considerations today. One of the reasons we think it's important for us to share this with you is because much of the conversation that we've had in the public of late is, I think, unfortunately, about when do you open, or what are kind of the dates or the politics or some of the more, I'll say frankly, superficial characteristics of what we're dealing with now. What we don't spend enough time talking about is the reality that we continue to have spread. We continue to have spread among at-risk populations. And so that's why I would say to anyone listening in Kansas City, and frankly anyone listening anywhere, this is why we have those recommendations like wearing your mask, particularly in public places, if you're around people, making sure that you generally stay home. And that's for people of all ages. But for those who are over the age of 65 or those with compromised immune systems, that's why we say we continue to do that. I know Dr. Archer will have more to say about not visiting senior care facilities or facilities where there may be persons with or in at-risk populations. And another step that's important for us, I know in Kansas City there are lots of people who are asking us, when will you open this or that? Because of course there are a number of things that remain closed in Kansas City. One of the reasons for that is we want to make sure that we can give guidance that will make people safe. I know that we had planned to give further guidance on Friday in connection with what we would be opening potentially a week from then, with the work that our health department is doing now to make sure we can contain an outbreak. I'm not sure if we'll be prepared to give that guidance tomorrow, and so therefore I'm not sure that we'll be in a position to say that some of those businesses should open next Friday. We'll have more communication with you in connection with that, but we know our primary goal is to make sure we keep the public healthy. Secondary to that is to make sure that we can do all the steps necessary to support our health department, our contact tracers, those who are testing, those who are making sure that there's not an outbreak. It's something that we owe to the citizens of Kansas City. It's something we owe to the citizens of this entire region. I've been on a lot of calls over recent weeks, and a number of those calls people said, well, things are fine in my part of the region or in my part of the city. I hope, I believe in this situation that people will recognize now that Viruses can jump rivers, they jump lines, they don't care about boundaries, they don't care about any particular community. We will do all we can in Kansas City to make sure that this COVID-19 outbreak is contained. We'll do everything we can to make sure that all who are at the McCracken facility are tested, that all who've come in contact with them have the opportunity to get tested. And we would ask any of you who are watching, who might have come in contact with someone who worked there, might yourself have been through the facility, to call our Department of Public Health. You can call 311 in Kansas City. We will make sure you can get adequate testing, or if you're not comfortable calling us, please call a healthcare provider. It's vital that we make sure we stop the spread. As we talk about living with COVID-19, which is largely the next phase of what our city and our country's experience with it will be, stopping outbreaks like this one will be core to what the mission of the Department of Public Health is. It'll be core to what we do at City Hall. So with that, I know Dr. Archer will speak after me, just to make sure we maintain adequate distancing. I'll take any questions you might have from my end. Dr. Archer will have a few more specifics on the facility. But if you have any questions for me, I'm happy to take them now.
Why do you think the 7 additional people who are living there and the 4 workers is a big outbreak for the city?
I'm going to force John to ask you.
Why is 7 additional people plus 4 workers a big outbreak?
So I'll save that for Dr. Archer in a moment. Any others? All right, seeing none, Dr. Archer, please.
When we think about priority issues with COVID-19, those of us that are over 60, those of us that have various pre-existing conditions, whether it's heart, lung, or immune problems, those that are over 70 are at even higher risk. And if they have both, it becomes really very, very serious. So all of our types of nursing homes, or as you probably are aware, more and more of the models have combined types of activities and populations at that facility. These become a top priority. We've been monitoring, we've been working with them. They've been working very hard across the city to reduce the types of folks that might be visiting that could bring the disease in. But as you're all aware, and the reason we have these masks on now, is that a large percentage, in some studies now 40 or more percent, of folks don't actually develop enough symptoms to know that they're spreading the disease. So the way we protect everybody is wearing these masks. And they're hot and they're uncomfortable, and not everybody knows how to wear them correctly, but we're learning. Now, this outbreak at this stage is not a big outbreak. By definition, we basically look at anytime we have 3 or more. And I also want to mention that of these different facilities that have had 1 or 2 cases, we've been able to manage it, work with them, isolate, quarantine, test, and not have it grow beyond that. There were actually a couple of earlier experiences at this same facility where that was exactly what happened. But this time, and actually I believe that of the 4 employees, only 1 is positive in this most recent situation. But we're in there, we're testing, we're going to find out, do we have more than 7 residents or not? The facility has already isolated those that are already identified as positive into a particular section and wing, so they're working with us on this. I just have to really emphasize that we've actually had, I think, more cases this week than we've had any other week since this outbreak started. So we're not out of the woods yet. As we open up over the next few days and weeks, I'm telling you, it's still not 100% safe out there. My personal recommendation, and what I'm following, is I wouldn't go and participate in a business that wasn't providing masks for their own employees and wasn't requiring the customers to have masks on, or better yet, giving them masks to come into their facility. Outbreaks are very difficult sometimes to manage, particularly if it's at a location that you don't know who was there. Now, the nursing home or in a senior living kind of complex, we know all the folks that were there. We know the staff, we know the residents. Usually we know, even if there's outside folks coming in, there's ways that that's tracked. Those we can handle more rapidly. But if we have an outbreak at a restaurant and we don't have a log, it'll be very difficult to, let's say one of you ate at that restaurant. And now we know that there was somebody there that spread the disease to others. And because you didn't share your name and the owner didn't keep a log, we can't call you to let you know before you then end up exposing your spouse or your loved one. So this takes us all, there's personal responsibility of all of us working together with these outbreaks. We'll know more as we get the tests back, and we'll keep you updated. Part of the reason we wanted to bring you together is we've had some requests for data on different facilities. We normally don't report individual cases that don't reach an outbreak at a facility because we want the facility to be working with us and not be worried about they're going to be on the nightly news because there's an outbreak or one case. So that's the reason that we share with you the overall data. If we have an outbreak like this where we have 3 or more cases, we will share that with you. So any questions?
Sometimes people hear, cases. Drive it home for people. Why does this one to you seem severe? Why does this one seem big? Why are you concerned about this particular incident?
So anytime you have spread in a facility that was occurring with people that were asymptomatic, that they didn't know they were ill, they couldn't protect themselves and others, then the potential of it growing pretty rapidly is there. The main reason I think that we wanted to talk about this is we want to remind people, you've got to protect the senior citizens. Don't force them to go out that don't need to go out for an activity. We're here because the potential is there, and as you know, in other nursing home outbreaks, you can have high mortality rates. At this point, we don't have any deaths. Hopefully we won't because we're on top of this, but these are very serious. Anybody getting the disease can have bad outcomes, but particularly in this type of population, so that's why we're on this.
Dr. Archer, with the growing number of cases and with some businesses reopening, is there a fear you're not going to have enough contact tracers to figure out where,
We already don't have enough. As most people in this room know, there's been 0 federal dollars that have gotten down to our health department for managing this outbreak. And that's been one of my concerns. The council has actually had to draw down on fund balance in our health levy to start some of our testing and contact tracing that we're doing right now. So we're hoping that we'll be getting those dollars. We've been moving through the process of posting for positions, advertising, interviewing, but we can't actually hire them until some of the dollars get here. And that's been a whole different story.
And Doctor, what do you want families who may be watching at home to know if they have a loved one that lives in this particular facility? I know you said those that are needing to be are isolated. What do you want families watching to know?
Well, the folks that have family or friends or that are either residents or staff, talking with them. I mean, we're all way too much socially isolated now because of this disease. So, talk with them. The residents need to hear and have support from those friends and family, but don't go visiting until we know where we are with this and how we can manage it better. I don't think the facility would let them in anyway, but I'm just saying. But what I want to really say is to the larger audience, we all know people over 60, 65 that are feeling, trapped at home. So interact with them, call them, talk with them, figure out how they can do, FaceTime or other kinds of things so that they can have that interaction, because we need to be supporting each other through this outbreak.
How about one more question? It's hard to breathe in these.
Dr. Archer, what was the nursing home testing employees? Were they requiring them to wear masks? What precautions was the facility taking?
So my staff working with them have a lot more of the details, but I'll tell you that we've been working with them, I think, since the 1st of March, the first day or week of March. And yeah, we've gone through different phases. They've actually tested all of their residents and staff a couple times at different phases. So they've been working through this with us, and we've been in contact all the way along. And this is the way any of the facilities in Kansas City need to approach this type of a situation. When they get 1 or 2 cases, then we have to figure out, is it more than that? In this case, it's enough more that, yes, we have to go in and really look at things. But, I appreciate everybody's time on this. Thank you.
Thank you.